I've never used something like this before, but hi, my name is Nina. Thank you so much for being here. I am a woman, she, her. I have had an abortion. I nearly died during childbirth, and I needed advanced reproductive health care. And because I had access to health care, I am a physician scientist, I am vice president of Doctors for America, and I have two beautiful children here. One in four women in this country have had an abortion. Doesn't matter if you're rich, poor, color of your skin, who you voted for. Why doesn't it matter? Because abortion is reproductive health care, and reproductive health care is health care, and it doesn't care who you are. That's right! And people who have access to reproductive health care are more likely to finish school, get jobs, get paid more for those jobs, have better mental health, and be in more stable, safe relationships. Unfortunately, in this country now, in over half of the states, people do not have access to reproductive health care. And we are seeing the results of this. We know the stories of women who are bleeding out in their cars or in the hallways, of people who have to be airlifted to a completely different state to get their health care. And now they're saying the quiet part out loud. We have governors saying they don't want access to abortions in their state because it would decrease teen pregnancies, which would decrease their state populations. And let this sink in. In the last 18 months, there have been 64,000 pregnant victims of rape who have not been able to access abortion services. What you did today, what we're doing today is so important, and thank you so much to the people who go out every day and help the providers and the patients get the help they deserve. But it doesn't end here. House Bill 790 would make sure that intolerant services in the state of Pennsylvania are available so that physicians could provide emergency reproductive health care to anyone who needs it. The current GOP bill cuts Medicaid and would defund Planned Parenthood. That would rip away health care from millions of women across this country. And please do not forget what Justice Clarence Thomas said when they overturned Roe v. Wade about going after LGBTQ plus health care. We allow people to get facelifts and breast augmentation and liposuction, but we do not allow gender-affirming care. Let me be very clear. Gender-affirming care and reproductive health care are health care, and health care is a human right. So please continue to speak up with your local, federal, and state folks. Please continue to educate the people around you, and please, for all of our children, get out the vote. Thank you so much.